Hi, it's Wendy Bowen, physiotherapist with Know Your Body Better. Today I have talked with a couple of people about their lower back and how it breaks down. And what we find very often when we look at the spine is that a lot of the breakdown happens down at the L5-S1, where your lower back meets your tailbone area, and that's where the curve changes. What I'm finding clinically, though, is many people have the stiffness through their mid-back area or their hips. And I've spoken about this before, whereas we're stiff here and stiff here, all the movement has to happen at the lower back. And the example that I'm giving them is if you take a stick or a pole or a rod, let's say this is the thoracic spine, your mid-back, this is your pelvis here, and these two parts aren't moving. So when you're bending it, all the bending is going to happen at one spot. And if I did this over and over and over again, bending, twisting, we're all gardening right now, it's summertime or it's springtime out here. If you're bending and twisting at the same spot, but your mid-back, which is supposed to do the rotation, and your hips that are supposed to do the rotation aren't moving, the breakdown is going to happen right here in the lower back. And if you look at the spine closely, which you might not be able to see, but these joints down here in our lower back help us bend forwards and backwards, where in our thoracic spine, your joints are a bit like this and they rotate more. So if you're stiff in throughout that mid-back area, you can't rotate, your lower back breaks down. And so the other thing that we're doing a lot right now is looking at what's happening in these outer muscles here, and are there trigger points out in these muscles that are kind of pulling you or keeping you stiff. And one of the muscles that I looked at in my last newsletter was the serratus anterior muscle. And one of the things that comes off the shoulder blade, but it wraps around from our shoulder blade all the way to our first rib, which is way up here, down to our ninth rib. That's how much attachment that muscle has. So if it's tight and tense, it's going to pull you into this position. And that creates a whole other group of problems, including the neck and the shoulder. If you're like this all the time, this is always on stretch, but it also twists the lower back. So if you're having problems in your lower back and all you're treating is your lower back, you might be finding that you're getting some relief, but you're not getting better. What we need to do is look at, are you tight in your mid-back? And you can probably find a video that I have on how to do the foam rolling and loosen off exercises for that. Get your hips and your pelvis as well, so your lower back stops taking all the strain. So it's Wendy Bowen with Know Your Body Better, looking at the whole body.